My name is Lisa Ferry. I'm the prostate cancer specialist nurse at Hollywood Private Hospital. The Prostate Cancer Specialist Nursing Service was developed back in 2011. The Prostate Cancer Foundation had done some great research and realised that there were so many unmet needs for men who had been diagnosed with prostate cancer. And so PCFA got some funding from Movember at the time. Hollywood, where I work, is a strong believer in supportive care, and so they applied to be one of the host hospitals. And we had amazing uptake right at the beginning. You know, the doctors recognised that getting a patient newly diagnosed is where the most help is needed, you know. So it's about meeting them in person, meeting them and their families, talking about their diagnosis, the treatment pathways, the options that they have, talking about supportive services with physio and sexual rehab. And then once they've made their treatment decision with their doctor, we would then be able to tailor that more specifically to where they are.
My name is Brian Schofield. I'm Operations Manager of IEE Global. During my prostate cancer journey, I received excellent support. First up from the nurses here at Hollywood. I then received support from a physio who specialised in prostate exercises, something I didn't know existed. And now I'm still receiving support. I do Pilates and reformer exercising every week to continue improving my health. The journey of prostate cancer is not an easy one. By sponsoring this video, my aim is to assist people in that journey, hopefully make that journey a little bit easier and not stressful.
Well, I think with any diagnosis, it's a very fearful time. And with prostate cancer diagnosis, you know, typically men don't often seek help and support. When patients come to me and they tell me they're feeling alone and they're feeling quite isolated, it's really important to develop a rapport with that patient and to try and find some background and do the distress screening with them and talk them through and just identify their risk factors or just their worries and concerns, whether it's financial, work related, if it's family related and they're a carer for somebody. There's some fantastic support, mainly through the Prostate Cancer Foundation. So there's a prostate cancer telephone nursing service that they can contact, especially people who might not have access to hospitals, whether they're remote or rural, regional people, and they may not have easy access to care. There are support groups all around Australia, and in WA we have the Mates Connect, which is a telephone-based support where men can ring this number and speak to other men who've gone through prostate cancer treatment. So that's just in a nutshell, and then you've got all the community support as well, and the Cancer Council do fantastic services as well with their Life Now programs.
There is a lot of groups, unknown groups out there that support prostate cancer. It's just a matter of finding them and not being shy about meeting fellow people who've had prostate cancer. I think it's a good thing to be very open about the journey, about the issues. An example is PROST.
PROST is an exercise group specifically for men who've been diagnosed with prostate cancer. My name is Ross Campbell. I'm the support group leader appointed by PCFA, and I'm chair of the corporation that runs PROST. We're here at the beautiful Leederville Oval here in Western Australia, which is also the home of Subiaco Football Club. You know, we're all men of 70 plus apart from a couple, but you know, we run around like young men playing soccer on this oval, doing exercises, and it's just fantastic. So physically, we do pelvic floor exercises with the idea of gaining urinary continence and erectile function again. They are two side effects of prostate cancer prostatectomies. And so emotionally, you can just hear it in the discussions that go on, which are very open. Between the men, we might be walking around the oval or doing some exercises, and you'll hear the discussions go on about things very personal, both in interrelationships, their own sense of where they're at in their journey, the fears they have, the successes they have. It's a wonderful group.
You know, like Danny, one of the nicest fellows you could ever meet, and Eric over there, terrific fellow, good looking as well. Ross, he's wonderful. And all these beautiful people here, the most dedicated group of people I've met in the last 30 years, really.
I think that's key. I think coming down and meeting some people who are actually going through the same sort of thing, so they can give you a lot of really good advice. And there's lots of good stories, very interesting stories, so coming into the group has been quite important actually.
And you're pre-op, aren't you?
I'm pre-op, yeah. So I'm finding out what it's going to happen after, so getting ready.
This is how he's going to end up looking. I looked like that last week.
PCFA support men through, they're the peak body in the community and they're community driven, and they have a big belief in supporting men and their families. So there's lots of research being done about developing treatments and understanding how prostate cancer impacts our community, but also in trying to find, identify risk factors, look obviously for more treatment pathways and things. So it's grassroots level and it's very well supported Australia-wide.
Prostate cancer needs funds to advance the development and research of a cure, better technology in operations. Without funding moving forward, a lot of organisations don't exist. Dollars make the world go around. Prostate cancer and prostate cancer support is much the same. Without the dollars, nothing happens. There's a lot of volunteers out there, but volunteering needs support for it to continue and make the journey a lot easier on us men.
It's important to know that you can come back into the service, it's an open referral to revisit with a prostate cancer nurse down the track into that survivorship to make sure that they are living as well as they can and that things are resolving for them, that if they were incontinent, that they've been addressing that with physiotherapy or going back to the specialist. Just there's lots of things that we can do to help, and it's not necessarily at diagnosis, but there's a lot in recovery and in survivorship that we can help them with as well. So it's just going to be important to know that they can always come back to their prostate cancer nurse even after treatment's finished.